Doctors and bad handwriting. This reminds me of a quip that a doctor once said, that I have such a good handwriting and patients don't believe that I'm a real doctor. That suggests how much of a thing this is. More like a cliche, and it's a known phenomenon all over the world. You could even call it a pandemic. Of all the professions in this whole wide world, the incidence of bad handwriting is higher among doctors as compared to their counterparts in the other professions. So what can explain this trend? In this video, we're going to be having a first-hand opinion from doctors themselves on why they think that they or their colleagues have bad handwriting. I'm sure you want to know why. You know what? I'm as curious as you are. Let's get rolling. By the way, and for our information, there is a learning disability that involves problems with the writing skill, and it's called dysgraphia. This abnormal, anything abnormal, graphia, writing. And most doctors suffering from dysgraphia, but come on now, the doctors, for crying out loud, and should be able to treat themselves.
True.
Right? Is medicine a cult? If not, why is it that medics can read one another's handwriting and others can't? Why? It's also believed by some that doctors write in a sloppy way, deliberately. It's said to be an attempt to ensure that patients don't understand what the doctors have written about them.
Oh, really?
Well, as much as I know that that is not a fact, I will say, if that helps to maintain some level of confidentiality in the hospital, then it's all well and good. Don't you think so? As one of them, in fact, I need to put on my word coat so that it won't be as if I'm trying to exempt myself now because we are talking about bad handwriting. Let me tell you how bad this is. More often than not, even doctors, we find it hard to read the handwriting of our fellow colleagues. I'm not supposed to be telling you that, though that's supposed to be a highly classified information. But because this video is about leaking out some of our secrets, I will tell you. Most times, we read our handwritings using ideas. I mean, doctors read fellow doctors' handwriting using ideas, and that's the truth. But when I mean using ideas, not just anyhow kind of idea, right? Because if it's just a general idea, then you should also be able to read. I mean, you've got some ideas. You're wise now. You're wise. If you think of it like a cult, you're actually correct. There's an initiation that we have undergone as doctors, and I will expatiate later. And I bet it that if I didn't go through medical school too, I'll probably not be able to read some police documentations that I read with ease. So let me show you how this really works. How we're able to read one another's handwriting. But you must promise me to keep this a secret. By the time you become a doctor, you would have been schooled into a world, like a system, a world, or a culture. In this culture, there's a way our speech flows. There's a way sentences are constructed. And that's why it's usually very easy for a doctor to be able to tell who is not one. Just allow him or her say about 5 medically related sentences. You just know that no, this guy is a doctor. I mean, it's really easy for us. Talking about this flow, you can almost know how a phrase or a clause or a sentence will continue or end if given their incomplete form. For example, if you have a phrase like nausea and vru in a colleague's write-up, nausea and another word beginning with the letter V, but you can't appreciate what the other letters of the word. Most doctors can figure out that the V word that we fit in is vomiting, that kind of thing. Because nausea and vomiting, it's a popular rhyme, nausea and vomiting, nausea and vomiting. They are popular symptoms often reported in association. So a doctor will be able to figure out when you see nausea and vru, it's not like you can really see clearly that the word is vomiting, but you can figure it out. Let me give you another example. If a colleague writes this, for instance, say in a referral letter, he writes a referral letter to me, and he writes something like, patient presented 3 days ago to the emergency department with a 5-day history or shortness of breath prior to because of the schooling and the medical idea of what is likely to be written after prior to complete that sentence in a medically sensible way. Most doctors, if not all, will be able to figure out that what is intended by the doctor who has written that referral to complete that sentence is presentation. Why is that? Because in the doctor's word, the phrase prior to presentation is a known thing. It rhymes. Most doctors will be able to figure that out and not struggle with trying to read exactly what the word the doctor intends. Despite that, in the actual sense, the writing is not readable. Take away the medical brain a doctor has.
Oh no.
You know what I mean, right? When I mean medical brain. And ask him to read the same write-ups and you will realize that he or she is as clueless just as you, that is a non-doctor, might be. This is the same way the pharmacists and other medical workers are able to cope with our not so fine handwriting. They read with some background ideas that make them preempt what we have written, even when it doesn't really look clear. Sometimes we are also able to figure out what a colleague writes in the middle or the latter end of a documentation by processing the information that he or she might have been writing from the beginning of the write-up. For instance, if the doctor has been describing that the patient has vomiting, diarrhea, and so on, but on getting to the point where he or she is to write the diagnosis, even if the writing becomes sloppy at that point, a doctor can figure out that the diagnosis here is acute gastroenteritis with no dehydration. So simply because the doctor has been processing so many information, talking about vomiting, talking about diarrhea. So by the time you get to the diagnosis, and putting 1 and 2 and 3 together, even though in the real sense of it, you can't actually see clearly the writings of the diagnosis, but you can figure it out. Somehow, no matter how sloppy, there will always be that one letter or more that will stand clear.
True.
Usually the first letter of the sloppy word that will help you to confirm if what you are thinking tallies with what the doctor has written. At times, some non-doctor health staffs bring the folder to me to try to confirm what a particular doctor has written in the write-up. And by the time they bring it up to me, I just take a minute or 30 seconds to read through, and by the time I see that, I just tell them what it is. And it looks like magic, like abracadabra. How did you even know it? Now, there's no rocket science about it. It's not like in the real sense. Like I said, if you take away my medical brain, my doctor's brain, I would not be able to read that same thing. But I've been able to just quickly read through, process what the doctor has written in the body of the history, body of the complaint. That's the long prose that doctors write about your complaint. Some patients will ask you when they see your voluminous write-up, when you're taking their history, and say, "Doc, is that how much problem I've got?" Others will ask, I say, "Doc, is that how many drugs I'm going to take home?" Because they're scared when they see your long write-up. It's not always about how much of a problem you've got or how much drug you're taking home. It's just a thing we do. We write, and it all depends on individual differences. Some of us are very worded and some are not. So reading by processing that I've described is just like seeing some kind of movies, and I won't mention names here. I won't. Halfway into the movie, you can do the kind of processing that I'm talking about and predict what will end the movie. And that's why some of us don't even like watching short movies. Anyways, that's not my business. So I haven't talked about how doctors have come to cope with their bad handwriting pandemic over the years. Let's address the roots of the matter. So why do doctors have bad handwriting? Let's now sample the opinion of doctors on why they think because some of them will tell you they don't have bad handwriting, especially the female among us. Why they think they or their colleagues have a not so good handwriting. I prefer to say not so good instead of saying bad, you know what I'm talking about. A not so good handwriting.
Doctors have bad handwriting. Okay, so here's my take on this. Not all of us do. I have a good handwriting. But I would say that in this part of the world, yes, majority of us we have really terrible handwriting, and I think that's because of how we were trained. You know, in medical school, we get to write a lot, like a lot, and you're not even done writing. They're taking off the slide, so anything that you can just jot down is just jotting down. Anyhow it comes out, anyhow it appears. So I think that just sticks with us. And in practice, I would say for me personally, my first 10 patients, my handwriting is still quite very legible, nice. Along the line, it begins to dip down because I'm already getting tired. So, one line, two line, and so that's it. So, please, impatient, pardon, wow. So, it's not like we are trying to just write rubbish and trying to hide information from you. No, it's just the pressure, tiwa.
We see a large volume of patients. But in another sense, as we go higher up or advance the ladder career-wise, we see less patients actually, but our handwriting still worsens. So I don't know. Somebody said it's because it's a communication code between us and our fellow colleagues, maybe.
Well, I personally feel having a bad handwriting is not only peculiar to medical doctors. We should remember the formative years of the child, as the handwriting is not developed in adulthood now. However, the medical training is a very cumbersome one, so it is understandable because we have to put down a lot of information within a short period of time. So, well, that might have contributed to the bad handwriting, quote and unquote, but it is what it is.
Oh, I think because we're always in a hurry, we have lots of patients to see, and we just want to just rush and see those patients. And that's our handwriting ends up being bad.
It's due to the medical training. So we work under stress. And that is why I think it looks as if we learned the writing that they taught us. No, it is not like that. It is due to the training that makes the writing to change. Whereas some people can cope with writing very fast and at the same time maintaining a legible writing. So let us demystify that fact that we are actually taught how to write jargons in medical school, so to say.
But let me see why I have terrible handwriting. It wasn't always like that. From like 200 level, 229, then 300 levels, then changing, 400 level, 500 level, 600 level, and now, like I'm proud of it and all but that. So what happened was that over a period of time, we had to write very, very fast. Like, teacher is in class and it's talking really fast, and you have to catch up with all what he's saying. You want to write as much as possible. Even during exams, you have a very short period of time to answer a whole lot of questions. You just have to be fast somehow. If you're able to go through that and your handwriting is still very fine, well, lucky you. And now, in practice, there are a lot of patients to be seen. So the way I just write like this.
So that's it from the doctor. Let's know what you think in the comment section. Kindly like and share this video. Subscribe if you have not done so. Always bear in mind, your health comes first. Can't you read this? Can't you read this?